Here is a new paper and a few associated blog posts that are worth reading. Hello and welcome to this week's Urgent Bite, brought to you by the Royal New Zealand College of Urgent Care. My name is Guy Melrose and today we look at a recently published paper in the Lancet that is worth a read. It is titled Effects of Tranexamic Acid on Death, Disability, Vascular Occlusive Events and Other Morbidities in Patients with Acute Traumatic Brain Injury, a randomised placebo-controlled trial. It is reporting on the CRASH-3 trial and involved 175 hospitals in 29 countries. Tranexamic acid is a subsidised drug in New Zealand in tablet form, and you might have used it in urgent care for various bleeding conditions. It is an antifibrinolytic and it works by reducing the conversion of plasminogen to plasmin, thus preventing fibrin degradation. A previous trial, called the CRASH-2 trial, found that the early administration of tranexamic acid in patients with severe extracranial bleeding reduced deaths by a third. So the CRASH-3 trial followed on from this and aimed to look at the effects of tranexamic acid on head injury-related death and disability, as well as the adverse effects of tranexamic acid. This was a large trial involving 12,737 patients from all over the world between 2012 and 2019. They included adults with traumatic brain injury, within 3 hours of injury, a GCS of 12 or lower, or any intracranial hemorrhage on CT. Now, if I read directly from their discussion, they state, "We found a substantial reduction in head injury-related deaths with tranexamic acid in patients with mild and moderate head injuries, but no apparent reduction in those with severe head injury." They go on to say, early treatment of patients with mild, that's GCS 13 to 15 and intracranial bleeding on baseline CT scan, and moderate head injury seemed to confer the greatest mortality benefit. And they also state, "We found no evidence of any increased risk of adverse events, in particular the risk of deep vein thrombosis, pulmonary embolism, stroke, myocardial infarction was similar in tranexamic acid and placebo groups." Now, you may have seen this reported in various media outlets around the world in the last few days. The BBC headline was, "Head injuries, cheap drug could save thousands of lives a year," for example. It was reading those headlines that prompted me to read this paper, as it seemed there could be something to change practice in urgent care. However, as it was administered to patients with confirmed bleed on CT, this moves it into the realm of the emergency department. Whether there is eventually a role for this in the pre-hospital setting, pre-CT scan, will be interesting to see. It's also worth noting that there have been a few blog posts and comments on medical Twitter that have questioned the statistical analysis. Dr. Rezai from the Rebel EM blog felt that the overall effect was actually not statistically significant when all patients were factored into the analysis. So we will have to watch and see how this changes emergency medicine practice going forwards in relation to head injury and whether there is any trickle down to urgent care practice in the future. In the show notes, I will link to the paper, which is currently open access, so you can read the whole thing, and I will also link to a few blogs that discuss the paper in more depth and are worth reading as well. I will also retweet a Twitter post that summarises the blogs too. This will be a paper that will probably get some debate going over the coming months, but for the time being it would be worth having a chat in your peer groups, and if you have any comments, questions, suggestions or corrections, email podcast@rnzcuc.org.nz. Now we'll be back next week with another podcast. I look forward to seeing you all then, but for now, thanks for listening.